What to Do About Opioids by Michael Poole. This following presentation will examine what to do about the current opioid epidemic. My main argument centers in that the American public needs to stop relying on addictive pain medication to deal with chronic pain. Healthcare professionals must realize that they have a responsibility to help and prevent their patients from becoming addicts. Opioids are valuable medications when used in the correct way and really can work miracles. What are opioids? Opioids are derived from poppy flowers. Various forms include fermented poppy seed teas, opium, morphine, and the newly synthesized opioids that we have here in the United States. There are over 60. Opioids are painkillers that have been around for thousands of years and were first used in a simple flower form known as a poppy. Poppy seeds have two compounds known as morphine and codeine that are still used in pill form today. There is evidence that ancient hunter-gatherers used the flowers to treat pain and also recreationally to obtain a euphoric high. The earliest known cultivation of poppies for said medicinal and recreational purposes were in the Mesopotamian river valley. Also known for being a euphoric sedative, the earliest known medicinal use of opium, which was derived from these poppies, is documented by Egyptian hieroglyphs depicting the use of teas and opium to ease the pain of childbirth. The great Chinese Dr. Hao Tou is documented as the first to use anesthesia coupled with opioids before major surgeries. This development of using painkillers with anesthesia was a revolutionary change in the way in which we approach medicine and allowed the patient to endure much more pain than would have been humanly possible without these painkillers. Opium also has somewhat of a dark side. It was an opioid that was smoked, and it was used mostly to obtain euphoric highs rather than medicinal purposes. There were several Qing dynasties in China that banned the importation and the selling of opium. It is still very prevalent throughout many Asian cultures. Morphine was synthesized in 1804 by a German chemist named Friedrich Stirner. This isolation of a compound found in poppy flowers proved to be a miracle drug. Morphine was 10 times more effective than opium at reducing pain and functioning as a painkiller. Morphine was named after the Greek god of dreams Morpheus and is still known as one of the most effective painkillers and is used as a standard against which all new drugs are tested. Morphine, coupled with the invention of the hypodermic needle, have greatly increased the capacity of doctors to save lives. Millions of lives have been saved through surgeries that wouldn't have been possible without opioids such as morphine. Newly synthesized opioids such as Percocet, Oxycodone, and Loratab are commonly used before surgeries throughout the United States and the world. How opioids work. Morphine, like opium, has a dark side. Morphine was used extensively throughout the American Civil War to allow doctors to perform amputations without killing their patients. They found that morphine was extremely addicting to these injured soldiers returning home. It was so addicting in fact, that morphine addiction became known as soldier's disease. In an effort to find a strain of morphine that was less addicting, chemists developed heroin. Heroin was thought to be the cure or the miracle drug. It was going to replace morphine and be less addicting because they had added additional carbons on the end of the chemical compound. Obviously, this failed. Heroin is just as addictive as morphine and works in almost identical pathways. Morphine and heroin are both considered opioids. So, opioids work by targeting natural opioid receptors in the brain. Our body has these to shut off pain messages once an injury is healed. Our body naturally produces androgenous opioids in our body. When morphine or heroin or Loratab or Percocet or Oxycontin is injected into the bloodstream, our body is overflooded with opioids that fool our body into activating these regions. This causes a numbing of pain, and also our brain fills with dopamine. Dopamine is the chemical of pleasure, and our brains are wired to ensure that we will repeat life sustaining activities denoted by the release of dopamine. We associate these activities with pleasure. Whenever this reward circuit is activated, the brain notes that something important is happening and needs to be remembered, and teaches us to do it again and again without thinking about it. Because drugs of abuse stimulate the same circuit, we learn to abuse drugs in the same way. This is why morphine, heroin, and other opioids are so destructive. So, if opioids are so destructive, why are there so many pills? Well, firstly, because opioids are extremely effective. They will take away any pain that you have. A recent study from the Mayo Clinic estimated that 7 out of every 10 Americans take prescription medications daily. Doctors provide their service to help foster the relief of pain and suffering of people. We all know that opioids are very effective and they work as they are intended to help block people's nocio or pain receptors. Americans have stopped dealing with pain by themselves. 100 years ago, people would just admit that they were old and know that they were going to feel pain in their joints. Americans instead go to a doctor and ask for a prescription to take their pain away. These doctors want to help their patients feel less pain. So they prescribe them opioids, which take away the pain. It's estimated that 7 out of every 10 Americans take prescription medications. On the right is a map showing the world's consumption of opioids. As you can tell, opioid addiction is something somewhat unique to the Western civilization, such as the United States, Canada, Germany, Britain, France, Spain, Australia, Scandinavian countries. And it's because people are asking for them. They don't want to feel pain. 50 years ago, if someone had walked into a doctor's office and said that their back hurt after carrying around their grandchildren, the doctor would stare them in the eyes and say, "You're old. Don't carry around your child on your back, your grandchild on your back. You're going to hurt yourself. You're not as young as you used to be." We need to move towards medicine that is more based on us managing our own pain rather than going to a doctor for some miracle pill. The opioid epidemic is displayed in this following map of the United States. As we can see, in some states there are more prescriptions than there are people. That is a sign that opioids are not being prescribed properly. As we can see, it affects almost all of the United States. There is not a single state where there are not more than 52 prescriptions per 100 people. Daily in the United States, 650,000 opioids are dispensed. That means that they are given out to people. 3,900 people begin abusing opioids or using them recreationally. And 78 people overdose and die from the use of opioids. And this is all found from the 2012 National Prescription Audit. How are medical professionals responsible? Well, this comes back to saying that was coined at first in the retail market. That is, the customer is always right. Drug companies have followed this by making bottles larger to reduce refills. Also, the Costco effect, making it so that it's cheaper to buy a large bulk of opioids for cheaper rather than buying just the amount of opioids that you need. and opioids have traditionally been cheaper than non-opioid medications. This has led lots of people to think of it as a cheaper and also a very effective alternative. Using Doctors also use patient satisfaction as a proxy for quality care. So rather than trying to really treat the patient or trying to go at the root of the problem, their doctors are satisfied knowing that their patients are satisfied because they're having euphoria effects from opioids and they're not feeling any pain. Many of these problems also stem from the fact that opioids were not fully understood to be as addicting as they really are. And the problem is that who can really tell if you're in pain or not besides you? It's up to you and what you decide and how you're willing to distinguish your pain. I can't rate your pain. I don't know how you're feeling. I can only know what you're telling me. And on the right, we can see different opioid prescriptions by the medical community. And as we can see, one of the highest is physical therapy. As we all know, this is a very hard and it's very painful for lots of people. And Americans need to realize that pain is a part of life, and even for physical therapy, the amount of opioid prescriptions being written is unacceptable. Some possible solutions to the opioid epidemic is to find ways to deal with pain without opioids. Valid options include activities such as yoga. Yoga has been proven to be a very cheap and somewhat effective way to relieve chronic pain. One study in particular linked the health benefits of yoga to stretching. Stretching allows muscles and joints to stay limber and not tense up. The same study cited over 8 different studies and concluded despite the diversity of stretching activities, all trials that included yoga and stretching improved back-related function symptoms and or reduced medication usage. For many people, yoga could be a viable alternative to deal with moderate to minimal chronic pain. Stretching helps to improve overall mobility and helps to break up tension that can increase pain. Another viable option is anti-inflammatory medication. Anti-inflammatory medication has been used to help with chronic pain for years, and it's a healthier alternative. Anti-inflammatory medications do not create a euphoric state and reduces inflammation, which is how the body swells after an injury. Arthritis, for example, is swelling that happens in joints usually after years of damage from manual labor or repetitive motion. Pain is usually caused by the swelling and inflammation and could be treated with a household of anti-inflammatories. Anti-inflammatories are drugs such as ibuprofen, Advil, and Tylenol. These are not addictive, and although they do have side effects. Many opioid prescriptions could instead be changed to anti-inflammatories, and patients would receive almost the same amount of pain relief. Nerve blocking is a relatively new technique that uses a small non-invasive surgery to destroy or to eliminate nerves that are firing signals back to the opioid receptors and showing that your body is having pain. If we take out these nerves and we block them, it'll make it so that the body will not experience the pain or that the brain will not register that the body is in pain. This has the same effect as an opioid, but it is a one-time non-invasive surgery, and it does not make it so that the person is addicted to a pill and they don't have to be taking these pills and getting refills and suffering the negative side effects of opioid addiction. All of these options are non-habit forming and they are very much healthier alternatives. We as a medical community need to explore these other viable options and we need to push for these in how we treat our patients. We need to come to realize that the customer is not always right. Sometimes they do not know what is best for them, and we as a medical community need to realize that we do know that opioid addiction is not beneficial in the long run, and we need to explore these better options. These are my different works cited. I have many of them. Here's page number 1 and here's page number 2. Thank you for listening to this presentation.